Good morning, everybody. My name is Etel Hajia. I am the Director of Public Education and Advocacy at Central Massachusetts Housing Alliance here in Worcester. Just wanted to thank everybody for joining our conference, our first collaboration between the YWCA of Central Massachusetts and Central Mass Housing Alliance to bring in a conversation with experts on the ground and policymakers around the intersections between domestic violence and homelessness. This hopefully will be one of the first in a series of conversations that we want to have with housing providers, domestic violence providers, and community members around these two important intersections. Before we jump into the program and provide a little bit of context about how this conversation was incepted, I would like for us to take a moment to keep in mind a 16-year-old child, Ma'Khia Bryant, who got shot by police last night at 4 p.m., just as the verdict for the murder by police, George Floyd's murder, was being read online. Just want to remind folks to keep Black and Brown community members in our hearts. If you represent an institution, if you are an activist or organizer, make sure that you are loud about dismantling white supremacy until justice is real. What happened in Derek Chauvin's case and the verdict is accountability. We have yet ways to go to bring full justice until no Black person, Brown and Indigenous person is murdered by police. So just keep everybody in light, especially the mother, the family members of 16-year-old Ma'Khia Bryant, an honor student, and as her mother described her, a peacemaker. How this conversation started, it was in October of 2020, we held at CMHA, held a conversation with Debbie Hall and Amanda Mattingly around the intersections of domestic violence and homelessness. It was during that meeting that Debbie and I started talking about bringing together folks in a more sustained way to talk about where the gaps are, what are the root causes, as well as what are steps that we can take, not just in training and bringing together these two universes, but most importantly, to really think about homelessness and domestic violence and not as not separate universes that operate without intersection. And so today's just the beginning of that conversation. And we hope what you get out of this amazing panelist and moderator that we're grateful to have here is just ideas about how we can come together more and also push for policy and concrete steps to not just eradicating homelessness, but also domestic violence. I want to add too that hopefully the conversation today will also bring a racial equity lens. Goes without saying that's a lens that we should all be taking in everything that we do. Before I turn it over to Debbie Hall to introduce our keynote speaker today, would like to provide a little bit of a snapshot, a little bit of framework and some numbers around that we have available statewide and also in Worcester County. According to the 2020 point in time, which essentially counts on a specific night in January, the number of sheltered and unsheltered people who experience homelessness across the state, there were 3,714 homeless households with children. And so that's 11,742 people. By the way, this is absolutely not a super inclusive number. This number does not count people who are currently doubled up or overcrowded. It just counts folks on that specific night that were sheltered or unsheltered. Out of that number, 1,170 are victims of domestic violence statewide. In Worcester County alone, 250 households or 773 people live in homelessness, experience homelessness, and 68 people were counted on the night of January 19, 2020 as victims of domestic violence. In FY 2020, according to DHCD, the Department of Community and Housing Development, domestic violence is the leading cause of why families with children seek family emergency shelter. And so when you look at that data, 90% of applicants who applied for family emergency shelter cited domestic violence as the reason for their homelessness. It goes without saying that families who enter shelter have already experienced some form of sexual domestic violence, eviction, or loss of a job. All things that are very relevant since the pandemic exacerbated all its conditions. And so this is kind of the larger framework. These are just numbers pertaining to families with children. Of course, intimate partner violence affects the LGBTQ community. There's racial disparities in all of these numbers as well. But just wanted to give folks an idea of why this is so important, especially for Worcester, where we see a large number of people who are being affected by COVID. So that is the general context. Let's have a good conference, good conversation. And I'd like to turn it over to Debbie Hall to introduce our keynote speaker.
Wonderful. Thank you, Atel. Thank you for that introduction. And as Atel alluded to, we still have a lot of work to do in this country and in this world around race equity, racism, white supremacy. So we want to keep folks in mind and keep in mind that violence occurs on so many different levels, and we should be aware of that and in conversation about that all the time. So at the October discussion, we had another guest, Stephanie Brown from Casa Myrna came in. I said, Stephanie, come in. Stephanie is a thought leader in housing, domestic violence, its interrelatedness. So I promised her then, I said, will you come back and be a speaker? Because we're going to put this conference together. And sure enough, we did. And she kept her word. And we're so happy to have her here with us this morning. Passionate about ending gender-based violence and poverty, Stephanie Brown became the Chief Executive Officer of Casa Myrna in July 2013. Casa Myrna is Boston's largest provider of domestic violence awareness, shelter, and comprehensive services to survivors of abuse. Prior to her tenure at Casa Myrna, Stephanie was the Assistant Commissioner for Policy, Program, and External Relations at the Massachusetts Department of Transitional Assistance. Her division was responsible for creating policies and programs related to the Commonwealth SNAP program, cash assistance, and employment services. Stephanie also served as DTA's Director of Housing and Homeless Services, managing the state shelter system for homeless families and individuals. As Assistant Commissioner, Stephanie focused on reducing barriers and increasing access to state and federal benefit programs to help low-income families achieve economic stability. I could go on and on about Stephanie because she's quite accomplished, but I don't want to take up a whole lot of time because she has some great things to say to us to get our conversation started about the interrelatedness of domestic violence and homelessness. So I'm going to pass it over to Stephanie.
All right, good morning, everybody. So thank you to Debbie and Atel, Amanda, Nicole, and Sophie. I love sort of being here in Central Mass. I mean, I wish we were in person, but I guess this will do. Many years ago, I used to come to the YWCA for a monthly coalition domestic violence policy meeting. And when I was at Homes for Families, which was before DTA, I couldn't wait for our annual legislative breakfast event with Central Mass Housing Alliance. So Grace Carmark always got the best turnout and facilitated very lively discussions with policymakers and homeless families. So it was always a good time. So like Atel said earlier, domestic violence and homelessness are not separate issues. I appreciate that Central Mass Housing Alliance and the YWCA are working to bridge the gap because that's something that we haven't done enough of and we need to do a lot more of for exactly the reasons that Atel said. So I want to talk a little bit about what we know about domestic violence and homelessness, sort of how we got to where we are and where it looks like we might be going. So I might be a little bit depressing for a while, but then I'll pick it up at the end about a lot of hope that I have for the system and for the work that we're all doing. So whether we recognize it or not, domestic violence and homelessness are inextricably linked. Over a third of survivors of domestic violence become homeless when they leave an abusive relationship. So in addition to the danger posed to survivors by their abusers just upon leaving, they're also forced to choose between staying in an abusive relationship and a roof over their heads and their children's heads. Over the past 30 years, and this is no surprise to anybody, housing costs have been increasing and the availability of affordable housing has been decreasing at pretty much the same levels. Consequently, the length of stay in our fewer than 200 domestic violence emergency shelter units has increased from 6 weeks to 3 months to 6 months and to now, in some cases, 18 or 24 months. So while we still basically we're operating transitional housing in our domestic violence shelter units, we haven't changed our model. We still think of ourselves as emergency shelter while we may have people in shelter for 18 or 24 months. So that's not feasible at all for survivors. And what used to be a respite to get safe, make a plan, and move on to permanent housing of their own has turned into a place where survivors get stuck in the system waiting for housing opportunities. The longer survivors stay in emergency shelters, the fewer units there are available for survivors fleeing. So if anybody's ever been working with somebody in a hospital or at a police station or who's sleeping in their car and has no place to go, you call domestic violence shelters and we say we're full. So we might have funds to put somebody in a hotel for a little while until we can figure out sort of how to come up with a plan for them. But there is no emergency shelter available for survivors, and it's a huge shame. So in other parts of the state, survivors seeking shelter have to choose which system they want to enter. Do they want to enter the homeless system or do they want to enter the domestic violence system if they were to be able to get into it? While there are many more housing shelter resources in the homeless system, thousands versus less than 200 units in the domestic violence system, the homeless shelter system is unlikely to be able to help with the domestic violence. The domestic violence system has lots of supports for survivors, but may not be able to help the survivors find housing or permanent housing that they can afford at the other end. If survivors make the wrong choice, they may be shut out of the other system. So why should any survivor have to make that kind of choice when what they're talking about is safety for themselves and their family? We've also boxed ourselves into the expectation that shelter is the right response for survivors at risk of homelessness. Like instead, shouldn't we expect that survivors deserve safe, permanent housing that they can afford and that homelessness shouldn't be the only option for them? So I give major kudos to the YWCA for piloting the ICAP project so that survivors in Central Mass don't have to make untenable choices like that. So the ICAP project that the YWCA is operating is a sort of a hybrid of domestic violence and homeless system and with diversion resources. And so that's really, I can't wait till we learn more from the YWCA about how that's working and how we can change our systems overall. And finally, like what we've always known in the domestic violence community is now more visible to everyone else since the onset of the pandemic. Home is not always a safe place. The isolation and social distancing that we're exercising in our communities to keep ourselves safe from the spread of the coronavirus is putting survivors at increased risk. Since the beginning of the pandemic, survivors have reported that abuse has been escalating both in frequency and volatility. Most of the opportunities survivors have to connect to safe resources are gone. Survivors are no longer able to access support confidentially from work, from school, their healthcare provider, faith community, or court. They're unable to reach for help when the abuser's out of the house. Finding the space away from their abuser to make a call for help is difficult, and making a plan to leave is nearly impossible right now. Survivors that have been able to find their way to domestic violence organizations find, like I said, the shelters are full. And because our shelters are full, domestic violence organizations have been putting survivors up in hotels. But that's a temporary and highly imperfect fix at best. And quite frankly, the money's going to run out. We've gotten a lot of money from government and foundations and individuals to be able to help survivors with rent and to be able to put them in hotels, but it's not going to last forever. And so the permanent solution is to ensure that survivors of domestic violence have safe housing that they can afford. But this crisis in which we find ourselves, of far more demand for shelter than we have units, is really partly of our own making. It's not just sort of out there and just in the environment. So how did we get here? It's easy to look back 40 years and say, I see what we did. We should have done X or Y instead of Z. But clearly, it's not that easy to see the long-term effects effects when you're in the middle of something. So historically, the domestic violence system, we began by distancing ourselves from homelessness and poverty issues. It's not that we didn't recognize those issues and we didn't want folks to have, economic security and housing. Instead, we needed people and systems to understand that domestic violence didn't discriminate, that it wasn't just something that low-income households dealt with. So anyone can be abused, regardless of education or income or zip code. So over time, even recognizing that most survivors with whom we work are at risk of homelessness, we've failed to build our housing system capacity. So in fact, when sort of scant housing resources do become available, domestic violence providers don't often have the capacity to take advantage of them. And we've seen this over time. We've also seen over this time that the homeless system is afraid to ask about domestic violence for fear of the answer. Of the thousands of households in the EA and individual shelter system, DTA has reported, when DTA used to have the shelter system, that nearly 60% of folks in the homeless system have been in an abusive relationship, and credit domestic violence to the original reason they became homeless. So the homeless system is working with survivors, but often survivors don't speak up for fear of being turned away or turned out. And if they do speak up, homeless providers often lack the tools and the resources to be able to support survivors. So now we find ourselves 30 to 40 years later with two separate systems that don't work very closely together, and really jostle survivors back and forth between them. So we have developed, different expertise. And as far as I can tell, we don't really collaborate very well overall. And because we weren't working together, we failed to ensure that our political leaders invest in permanent housing solutions. So that's all the depressing part. So now I will talk about the good news. Where we're going, where we are now and where we're going. So I've been at this a long while, like Debbie said, and I can say with confidence that a lot is happening right now. It really, really feels like we are at a precipice of change, and that if we don't continue to embrace this change and to really push it, we may lose our momentum. And like the synergy, like I can't stand that word, but sort of like the cooperation and the resources that we have right now at our disposal don't come around that often. So we have to take advantage of the point in time we are now, and get more resources and work together better to create some systemic change. So a couple of the things I was going to talk about is really what seems to be happening right now and why I'm really excited about the future and what could be happening. So right now, through the Governor's Council to Address Sexual Assault and Domestic Violence, I co-chair a housing committee. And so the housing committee has lots of people doing lots of work around the state. And one of the things that they're doing is investing in housing training of sexual and domestic violence advocates to really increase our housing literacy and to understand the housing systems and to be able to support survivors in their search for housing. At the same time, we're also doing training on sexual and domestic violence for housing providers, because management companies and local housing authorities, resident folks who deal with residents are all dealing with domestic violence. They just don't know what to do with it. So we're trying to give everybody the tools and the information they need to be able to support survivors wherever they are, and at the same time build some relationships so that we can do it together. At the same time, or so coming up, actually later this spring, Department of Housing and Community Development is going to be hosting a housing search and homelessness diversion training for sexual and domestic violence advocates. So sort of this training and all this housing literacy is really important, because if we don't have that, we're not going to be able to move to the next stage. We're also talking to multifamily housing providers, with whom most of us have never worked before. I think the go-to place for housing for the domestic violence system is the local housing authority. Apply for Section 8, apply for public housing. But there's this whole world that you all know of multifamily housing providers that have subsidized units. And so we're just really starting to connect with them and talk with them and create relationship with them about how we can access those units. We're also seeing across the state record levels of HUD funding targeted to domestic violence survivors through the continuums of care. And so we're trying to prepare the continuums of care and the domestic violence organizations to be ready to apply if more funding is released, because we don't want any of that. It's not in competition for the regular continuum of care funding. And so we don't want any of that to be not used. If we can have it, we want to use it. We've also been working with Department of Housing and Community Development to implement a pilot emergency transfer process for sexual and domestic violence survivors in some of DHCD's HUD-funded housing units. So through this pilot, Casa Mirna will be able to help survivors in home and housing trust fund units to apply for an emergency transfer. And long term, we're hoping that this will lead to a statewide system where sort of multifamily housing providers and housing authorities, if they have folks who need to do an emergency transfer, will have sort of a list of where all the transfers need to be made across the state so that folks can safely move to other developments. Because right now, you can get an emergency transfer, but there's no place to go. So you're basically still stuck there until something opens up. So we're really looking at this as sort of seeding a longer term or a bigger process where there actually are units that people can move across the state to places that are safe and affordable. And there's more. So the Safe Housing Massachusetts Partnership Project, which is a project through Department of Public Health, Jane Doe, Casa Mirna, and Pilch Associates, is attempting to develop domestic violence organizations' housing capacity and to advocate for public policies that would increase housing availability to survivors, to both sexual and domestic violence survivors. We're creating a housing learning community that's working to better educate the sexual and domestic violence system about housing and to build strong, lasting relationships between domestic violence programs and housing providers. And we have record interest from folks in doing this. Casa Mirna, with our Boston domestic violence program sister partners, or sister organizations, we just finished hosting an Intro to Housing series of 5 workshops for survivors across the state. And we had probably 60 to 70 folks in regular attendance in these 5 workshops. And it turns out that a majority were actually domestic violence advocates who wanted to learn about housing. So honestly, like never before have I seen this kind of interest in housing from the domestic violence system. We're also seeing that domestic violence providers, so thanks to Jane Doe's policy advocacy, we got an increase for FY21 and FY20, and hopefully we'll get it in FY22 for our community-based services. And so we're really seeing that domestic violence providers are going to use some of that funding to develop their capacity for housing search and for housing advocacy and housing stabilization. So just a heads up to the homeless and housing system, we're going to need your help as we implement the staff who do this work. We would love for you to work with us and help us do it well. Let's learn from your mistakes instead of making our own all over, from the beginning. Our systems have also collectively, I think, the domestic violence and clearly the homeless shelter system. We have MRVPs, the Massachusetts Rental Voucher Program, so the state housing vouchers, to move hundreds of families out of EA and individual and domestic violence shelters. And so just many, many thanks to the legislature for investing in MRVP and from DHCD, Alvina Brevard and Libby Hayes for getting the vouchers out quickly and for prioritizing households in shelter. And so that is something that is affecting all of us and hopefully will help us all clear out the shelters and then be able to take folks who really need shelter into our home, into our buildings or into our supports. And as we're beginning to, I think all of this at this time is also helping us, envision a different domestic violence shelter system. So to be able to help survivors escape during the pandemic, many of us have rented short-term apartments or extended stay hotel rooms in which to move survivors who were living with their abuser out of that abusive relationship. But the funding to support these units will end soon, and we don't want to return to pre-pandemic normal. And so it's really important for us to have discussions with the homeless world about what shelter could look like and how we can do it differently, and how do we reduce shelter stays and get people out of shelter into permanent housing quickly. I think we're all agreed that we cannot return to normal. Normal is an overburdened domestic violence and EA and individual shelter system with increasingly long stays and never enough space. So normal is survivors having to choose between staying in an abusive relationship and homelessness because of the severe lack of housing that survivors can afford. So lots of exciting stuff going on. So what do we need to do next? You know, what happens next? How do we hold on to this? How do we expand this? So every single one of us needs to speak up and get involved in policy advocacy. You know, we need to reach out to the governor and the lieutenant governor and our legislators and town councils to, you know, thank them for the resources they've provided over the past year, tell them how we used it, that it, you know, it went to good use and it made a difference in people's lives, and advocate for more. If you don't know where to start, Hema Sarang-Sumensky is on the panel coming up next. She's Jane Doe's policy director, and she can tell you where to start. But start, whatever you do, like call your legislators and, you know, thank them and advocate for more resources. You know, educate yourselves about domestic violence or about housing or homelessness. Like if you don't know one system, learn about it. You know, while you're at it, educate yourself about the, you know, the multiple factors that contribute to further marginalization and victimization of survivors. It makes it even more difficult for them to escape abuse. You know, racism, xenophobia, homophobia, transphobia, ableism, other forms of oppression just sort of compound the abuse that survivors are living with and make it that much harder for them to become independent of abuse. So continue to advocate for more MRVPs. You know, if you'd like to get involved in the work of the Governor's Council, there's room for everybody who's interested on our Housing Stability Committee. So if you want to get involved, let me know. We'll put you on the list. Happy to have you. There's plenty of work for everybody. You know, through your continuums of care, if, you know, apply for HUD funding if they release more domestic violence bonus money. So a group of us are trying to put together, sort of those of us that do have HUD funding, this DV bonus money, domestic violence bonus money, are trying to put together like all of our applications so that we can just hand it over to continuums and other providers and say, here's what we wrote. Take it or leave it, use it if you want to, but here's, you know, sort of a guide to make it easy for people, because we need to get that money into the state. You know, reach out and meet your counterparts at sister organizations. You know, relationships are key to doing this work. Like we all know that, you know, relationships with housing providers and with each other. It's much easier to work with somebody that you know and you have a relationship, so that you can call up and say, you know, I'm struggling with this issue. Help me think through it. You know, what can I do about this? Because we all have expertise and you know, and knowledge to bring to each other. Create genuine, strong relationships with housing providers. You know, offer to help them support domestic violence survivors. You know, and push them to create priorities and create set-asides for sexual and domestic violence survivors. Don't lose sight of the fact that we are advocating for housing resources, while we're advocating for housing resources, survivors also need economic stability to be free from abuse. So instead of just focusing on housing, we also need to focus on increasing, you know, on how survivors can increase their income, employment supports, and jobs that pay a living wage, because we want housing to be affordable to folks, and not everybody should have to wait for subsidized housing. I challenge you all to collaborate. You know, Debbie talked about the work that she and CMHA are doing together, like they're collaborating. Like we have to learn from each other, because none of us can do this ourselves. We have to train each other and share job descriptions and best practices and resources and our expertise. We don't have to duplicate our work. We can complement each other, and we are so much stronger together. And I think we all know that, but we have to carve out the time to be able to do it. And finally, like, continue having these conversations. I love that this is the first conference in a series. And if we work together, we can do the name of this conference justice. Like, think about it, close the gap between domestic violence and homelessness. I think I really feel like if we join forces, we can end homelessness and housing insecurity in the Commonwealth, and we can ensure that all survivors have a safe place to call home. So that's my 2 cents. And now I will pass it on, I think, back to Debbie Ortel to introduce the panel.
Wonderful. Thank you. Thank you so much, Stephanie. I appreciate all the work you've done in this area for sure. And as Stephanie said, I mean, there's a lot to think about. Collaboration really is the key. And what you'll hear on from this panel discussion, or what will be touched on, we have folks, you know, across the country doing the work, and we are trying innovative ways of helping survivors find housing, more permanent housing. So we look forward to the discussion. Again, Stephanie, thank you. Reach out to Stephanie if you have any questions or you're interested in participating in any of these subcommittees, there's always a space available. It's definitely a relevant and timely discussion. So next up, I'm going to introduce Dr. Nicole Overstreet. She will moderate the panel and have the panelists introduce themselves. But Dr. Overstreet is an associate professor in psychology at Clark University. Her program of research uses intersectionality to examine how interlocking systems of power, that is racism, sexism, gendered racism, affect marginalized communities, particularly Black girls and women. Specifically, her work focuses on the function of ideologies, stereotypes, and how they maintain and sustain violence against Black girls and women. She also examines how Black women resist stereotypes. Her second line of research explores how stigma affects women of color's health concerns in various social contexts. Collectively, this work addresses health inequities and advances socially just and equitable health research. Nicole does so much more than that and everything, and definitely has an interest and has been also a thought leader in terms of research and speaking about domestic violence and the intersections of racism, heterosexism in her work. So I will turn it over now to you, Nicole, and look forward to the panel discussion.
Okay, great. Thank you, Debbie, for that introduction. And Stephanie, thank you for providing us with the critical context of the confluence of domestic violence and homelessness. And we're going to continue that discussion today with our panelists. And so first, I'm going to ask Kelly to introduce yourself.
Good morning. My name is Kelly Henry. I am the Senior Director of Housing at Sojourner House here in Rhode Island. I have about 25 years of working with domestic violence and sexual assault survivors and about 10 years working specifically around housing with DV and sexual assault survivors. And we run a relatively large housing program down here with permanent supportive housing, rapid rehousing, transitional housing, and rental assistance. And we're always looking at creative ways to meet the challenges of housing survivors. So thanks.
Yeah, great to have you on the panel. Parley?
Lisa, good morning, everyone. My name is Carly Jones, and I am the shelter manager for Abby's House. Abby's House provides 77 units of housing strictly for women with or without children. We have a 9-bed shelter, which unfortunately with COVID, we are down to 7, and we have one of the best gift shops in the city. I'm glad to be here. Thank you.
Thank you, Parley. Amanda?
Good morning. My name is Amanda Mattingly, and my pronouns are she and hers. And I supervise ICAP at the YWCA of Central Mass. ICAP is a pilot program working with survivors of domestic and sexual violence who are experiencing housing instability or homelessness. And we use a well-being approach to try to support people in making their next steps forward.
Thank you, Amanda. And finally, Hema.
Good morning, all. My name is Hema Saring-Saminsky. I use she and they pronouns, and I'm the policy director at Jane Doe Inc. Jane Doe Inc. is the Massachusetts Coalition to End Sexual and Domestic Violence. And we have 59 member programs across the state working to support survivors. You know, my background is as an immigration attorney, and I've worked very much in the spaces of uplifting the unique policy concerns and needs of survivors at the intersections of a variety of oppressions. So thank you so much for having me.
Thank you, Hema. I'm really excited for us to be talking about this and thinking through how we can close the gap between domestic violence and housing insecurity. So each of you come at this issue from different sectors and different lenses. And I'm wondering if you can provide a little more context of the intersections between domestic violence and housing insecurity from your perspectives. So who wants to start us off with this question?
I'm happy to go if that's okay. So I think that historically, I think that there's been like two major issues with the gap between homelessness and DV. I think that a lot of times DV providers have historically felt that they are the only ones working with DV survivors, and the phone's ringing, and that DV survivors only ever interface with DV agencies, which is false for a lot of reasons. And then I think the other thing is, I think the federal government and a lot of funders often see folks who are homeless as chronically homeless individuals. Like, so you're looking at like homeless men on the street, particularly white men, and the definitions by which the federal government has like set up for chronic homelessness, allowing for folks to get permanent supportive housing, are often hard to meet for some of the survivors that we see, particularly women with children, trans folks who are addicted to substances or have serious mental health issues. And so there's this weird dynamic where DV providers are like, we're working with all the DV survivors. And even though a lot of DV agencies want to prioritize the folks that are most vulnerable, meaning, trans folks with large families, undocumented families, undocumented folks, folks who are chronically mentally ill, there aren't enough supportive services within the DV agencies to provide robust services for these folks. And so there's this like kind of clash. And then, the homeless system has kind of developed this idea with the federal government that chronically homeless folks, get permanent supportive housing. And even the assessment tools that a lot of COCs and states that use to assess homeless folks don't take into account the lethality assessments that make DV victims more likely to, be murdered or seriously injured. And so, you have this real clash. So a lot of times DV providers are trying to twist and turn and bend their clients to fit all these shapes, when in fact, what we need to do is more advocacy with our COCs and our state funding to kind of challenge this idea that who in our systems of homelessness and DV, who deserves to get supportive housing. And I personally believe that, the idea that there's only a limited amount of resources is harmful to everyone. I do think what Stephanie said is we are stronger when we work together. And so we do need to work better together, and not let this idea that there's only a limited amount of resources, so we have to compete with each other to get services for our clients. But I do think we have to think creatively how to do it. So, we talk about, so like when we started our permanent supportive housing program, we started to see a lot of folks who are survivors who have serious mental health issues. And so one of the things we started to do is we really started to work on getting our clinical program up and running, as well as reaching out to other homeless providers and seeing if there's some sort of collaboration we can do around substance abuse, around chronic mental illness, around maybe having a psychiatric nurse, so that we can provide support to these folks and they can remain in their housing. Thanks.
Thank you for that. Amanda, do you want to jump in here to add your perspective?
Yeah, thank you. So there is a huge overlap between people who are experiencing housing instability and homelessness and people who have survived domestic violence or sexual violence. Like Atel and Stephanie both highlighted, most women especially, looking for shelter who need support in their area are survivors. And I think what's important to note is that anyone can become homeless if enough goes wrong and the right support is not available. But survivors of domestic violence really are uniquely vulnerable, just because of the frequency of financial abuse in domestic violence relationships as a huge factor. And then all the barriers that are in place to get support. There's a huge problem with people not being eligible for services. people kind of getting stuck in systems, like Stephanie was mentioning. So I think when we talk about the homeless population and the survivor population, they're the same people for the most part. It doesn't make sense for us to be working kind of parallel to each other. We really do need to collaborate because we're serving the same people. Just like Kelly was just saying, the same people are coming to us for help. And it does not make sense for us not to be talking to each other. Because what happens is so many different systems have different requirements and different language and different points of entry. And so survivors are sort of just shuttled between each point of entry or system and not really getting the kind of wraparound complex support that they need. And I would also say that for survivors specifically, but for I think anybody, one of the biggest resiliency factors in preventing homelessness is having a wide and helpful support system, that like network of social supports. And for so many survivors, those supports have been either ripped away by abuse or the people in their lives are also struggling and they can't stay with friends or family. They can't get financial support from them, or it's not safe because they really are in danger from their abuser. And I've heard from many people that they don't want to stay with their friends and family because they don't want them to be also at risk. So those are two big factors, the financial abuse and having a network of social support.
You know, Amanda, listening to you talk about the connections between domestic violence and housing insecurity reminds me of a project I'm collaborating with one of my colleagues to understand how COVID has impacted this intersection between domestic violence and housing insecurity for Black survivors, for Black women who are survivors of domestic violence. And one of the things that interestingly came out of those data were women sharing their stories and narratives about how their social network has decreased tremendously because Black people are disproportionately affected by COVID. So their social networks have been dramatically reduced because folks have died due to the COVID-19 pandemic. And so that was something that really struck me and stood out to me in thinking about this connection between DV, housing insecurity, and also racism, right, given the COVID-19 pandemic. So I'm wondering if we can move on to talk about gaps in services and talk specifically maybe about how these gaps have changed or been exacerbated by COVID-19.
I'll go. So I think that, you know, we've started to see, I mean, since COVID-19 started, we had already had clients who struggled to, you know, make a living wage, who had struggled to find quality childcare, who had struggled with transportation issues. And then it disproportionately affected the folks, you know, so for, you know, many middle-class folks, as soon as the pandemic hit, a lot of people were able to work from home, but a lot of our survivors who we work with were not, you know, so they got laid off on their jobs in food service, in schools, daycares. I mean, all those folks got laid off. And what we saw was because they were laid off, a lot of times they were getting childcare assistance through the DHS office. And because they weren't working, their childcare was taken from them. And so then there was this this really hurtful and harmful of them trying to not only find jobs, but try to get childcare so that they could go back to work. But by the time that our clients tried to go back to work, often the daycares had these restrictions in place for COVID, due to COVID, where they could only have 50% or less of the children in the daycare, right? And a lot of times folks were going to home daycares because it was a cousin or friend or family member. But a lot of our home daycares actually had to shut down because they couldn't even provide the space distance or the the COVID restrictions that the CDC had put on the home daycares. So we saw a lot of in-home childcare centers shutting down. And so that disproportionately affected folks of color, especially women of color. And we started to see, I have a lot of moms, who are like reaching out to me all the time, looking for units, unable to work. They know that their rapid rehousing rental assistance or their transitional housing is ending. But because only maybe even the last few weeks, if it even has happened yet, they've been able to re-engage in daycare, childcare, that they haven't even begun to find a job. And so, we see that like folks of color, families of color are falling in a hole that that they're having a really hard time getting out of. And it's due to, COVID and the systemic racism around, all these systems that are hard to navigate. And it kind of shows, I think that it really shows the gaps that we needed to address long before this happened. But now that this has happened, we see the gaps. We see how children, how folks were going hungry before now, or how folks need a livable wage, or how folks need job training and inviable jobs. Like that's one of my biggest annoying pet peeves is there's all these job training programs, but a lot of the job training programs for folks in shelters is like low income jobs. So right, like food service, janitorial service, CNAs. And I'm always like, why can't we train folks to do tech jobs? And I know there's a higher level, but I just think that like if we're educating people for job training programs where they're not going to even be able to make $15, $16, $17 an hour, then what's the point? Because they're never going to be able to afford the $1,200, $1,300, $1,400 rents that they need to pay at the end of the program. And so I think that we as DV advocates need to like challenge ourselves. Like, is there a way that we can think creatively to get folks what they need, so when they're done our programs, we'll see positive outcomes and we'll see people who aren't going to be reliant on systems. But instead we'll have like real opportunity for themselves and their family.
If I can add to that, I think what you pointed out, Kelly, is really important because we do have a class system in this country. And that was in place before COVID, and COVID really just laid it bare and really exacerbated circumstances for a lot of the families that we work with. And I think you make a good point about, why are all those job trainings kind of training for lower income jobs? And on the one hand, we should be helping people get into the better paying jobs. But on the other hand, all those jobs should pay well. All those jobs are important. And we really keep people in these sort of class systems, class levels, and it is very intentional. And I think oftentimes systems can reinforce those, even when they're meant to help, they can reinforce those sort of class levels, even with the best of intentions. That's why we look at Social Security benefits for disabled people, and how people who are disabled can't keep any money in savings or else they lose their benefits. And how does that, uniquely affect survivors of domestic violence who are disabled if they can't keep any money on hand, and they know that if they leave their partner, they're going to only have this income, which may be like $800 a month. And so that right there is a huge barrier to leaving, and a huge, instigator for homelessness. That person just decides they will be safer if they leave. There's not really anywhere for them to go easily. So that I think was really made even more clear by COVID, because all the rental opportunities really slowed down. The beginning of the pandemic last March was a really scary time because we didn't know what was going on, and everything kind of shut down, and people really didn't know sort of where to look for help. And with that, there was not much movement in shelters, not much movement in and out of apartments. And so people really got stuck where they were. People that I work with really got stuck where they were for a while. Hope that answers the question.
Yes, definitely. Hema or Parley, do you want to add anything here about gaps?
I just wanted to start off with, luckily we're talking about women that were actually able to access shelter. So the fact that there's less than or around 150 quote unquote domestic violence shelter beds in the state is where the problems kind of start. And I know that shelter is not the answer. I know that the answer is safe, affordable housing. Both of those adjectives need to go with the housing, because what's available to some people that have a voucher, we wouldn't want to live there. So why are we expecting other people to live there? You know what I mean? So I think that the shelter bed piece is huge, actually being able to access a shelter for some people that are calling. I know when I get calls, sometimes I have to say, well, did you try Rhode Island? Did you try Connecticut? Did you try New Hampshire? And, that's not a good feeling, even though you're trying to get away from your abuser. You're not trying to totally leave your state. So for me, I think it's the availability of a safe shelter.
Yeah, thanks all. I am going to mostly echo what everybody shared, and just to add a couple things. I mean, I think, that piece about the relationship with what Parley just shared and what Stephanie was sharing earlier, and Kelly, I mean, that relationship building and coordination piece is so huge. And it really feels like this one piece of the puzzle in freeing up additional space in shelters and, really building some of those relationships with housing providers as one small piece. I think questions that come to mind, especially in light of this moment, I think everything has gone a bit more underground in some ways because of the pandemic and the dual pandemics of COVID as well as white supremacy. And, I think programs asking ourselves the critical questions of, what are the additional barriers for survivors who are most at the intersections of oppression, in terms of accessing our existing programs. I know that the Network Let Ed just released their community impact survey with a lot of great data on access for LGBTQ survivors. That's just one piece in terms of asking that question. I feel like issues around anti-discrimination related work are so critical right now. That access piece is huge, and access, I think, has become even more challenging in the time of COVID because of the lack of, in some ways, scrutiny of systems, of providers, of landlords, of a variety of folks who are really taking this moment to take advantage of our most vulnerable community members in so many ways. And, in terms of one gap that I just wanted to flag that's come up more recently in terms of some of our work at the intersection of child welfare related advocacy, there is this kind of catch-22 for so many survivors who are involved in child welfare system related responses, but then have those very responses, impact their ability to get and connect to housing, right? You get priority status and for subsidized housing, as family in terms of your family identity. And when survivors are caught in that cycle and that circle with child welfare interventions, it's a tough situation to try to both get adequate housing and get their kids back. So just something we're keeping our eye on.
I mean, I think each of you are highlighting how historically these deep structural issues have been exacerbated over time. And that really came to bear, as Amanda said, in the COVID-19 pandemic. And so I think just moving forward, having that analysis of how these are interconnected issues really pushes us to think about closing the gap and working together in closing that gap. And so Atel is providing some good information in the chat. I wanted to point out a point that Atel made. Atel said, according to the National Low Income Housing Coalition, in order to afford a modest 2-bedroom apartment in Worcester and surrounding communities at the average renter wage of $14.12, a renter would need to work 76 hours per week, 52 weeks per year. And a couple of you have mentioned safe and affordable housing. And so what this brings to mind to me is Worcester is rapidly gentrifying, right? So we're talking about a number of structural issues, this being another. I'm wondering if anyone wants to chime in here about what this would mean for safe and affordable housing for survivors thinking about gentrification in Worcester.
Well, I can chime in, working in Worcester and supporting people in housing searches. Just in the last year, I have really seen rents skyrocket. And I really don't know where people are supposed to live, because people in the city that I'm working with in the surrounding areas, including North Central Massachusetts, Fitchburg, Leominster area, they are working full time. They have, good assets. They have a car. They have good social support, and there's just no apartments that they can afford to rent on their own. Most of the survivors that I work with have a single income household, and it does not fly. It does not match up with what the rents are. And people began looking at kind of a wider and wider sort of net of geography. Like, maybe I don't have to live in Worcester. Maybe I can live somewhere outside of Worcester. And even those rents are going up. In addition to the fact that a lot of the towns in surrounding Worcester are full of mostly homeowners and not so much rental opportunities. And that truly is because of gentrification. We have this renaissance in Worcester, or kind of making Worcester a better place to live. And there's all these nice little shops popping up. There's lots of changes that are happening in the city. And there's all these luxury apartments popping up, and I don't know who those are for. Well, I do know, and they're for commuters from Boston, right? Not for people who really live here. And people are being forced out. Even people with good paying jobs just can't keep up with the rents.
I think to this issue of classism, and you talking about deep class divides. So again, this being exacerbated in the time of COVID, and thinking about a lack of legislation around landlords buying multiple properties and increasing rents. So Atel is adding in the chat that over the last 6 years, rents in Worcester have consistently increased month over month, resulting in a nearly 50% increase in market rent. And I can imagine that will grow as well over the next few months. So speaking of gentrification, are there other barriers that domestic violence survivors face in having to access safe shelter and finding stable and safe housing?
So I just wanted to just briefly, what you had said kind of touched on something that I was thinking about. And one thing that we've started to see in the area is that because DV agencies haven't kept up with some of the technical assistance that we see homeless agencies and homeless advocates get and receive and take, that there's starting to be a gap in the money that homeless agencies get to house homeless folks compared to DV agencies get to house DV folks. And even more sad, we're starting to see Some outlier homeless agencies and outlier DV agencies shut down shelter beds or shut down housing beds because they no longer want to get the federal funding because there are requirements that they don't understand or can't keep up with for whatever reason, because they don't have the technical support and they don't have that knowledge, the literacy around what needs to happen. And so, you know, we've started to see beds go to the wayside and be bought by, you know, agencies sell their property because the market is doing so well. And it's a real shame because we're starting, like, they might just be outliers, but we're starting to lose beds within our system because folks don't have the knowledge. And so I would really encourage everyone to try to build some of that knowledge, because we had too few beds to begin with, and if we lose more beds, it'll be detrimental.
Hey, I wanted to know if you want to chime in here and speak to this issue.
I mean, I think the one thing in terms of specific barriers, I mean, this is kind of at the intersection of some policy related directions that we're thinking about. But I do feel like, you know, in the spirit of, you know, all of these conversations about our criminal legal system and what that means, you know, I think there is this very critical area in this gap around, you know, economic instability leads to the criminalization of survivors and also leads to reduced access to housing. And I think those connections really are largely, you know, a bit underground, I think, from all perspectives, except those survivors who are most impacted by those realities. So, I mean, I think that having, you know, thinking, we can talk about some of the policy directions later, but, you know, when you, let's look at the unique needs of survivors who have criminal histories of their own and examine how exactly, you know, what kind of housing advocacy does it take to overcome some of those barriers and get so many survivors who are in those situations because of, you know, crimes related to survival, right? Whether it's you know, dealing with trauma through addiction or economic crimes, you know, things that folks are doing to survive, you know, what are ways in which we can, you know, minimize those barriers to get folks the resources they need and, you know, keep them out of the risk of homelessness.
Yeah, thank you for that. I keep coming back to the project that and the research that I'm collaborating on. And one of the things that, again, came up with Black survivors thinking about gentrification, which we didn't talk about, was evictions. And evictions play a large role in being able to secure future housing. And so, you know, some survivors mentioned having a second chance program, but I'm wondering if you all have seen that come up in your work where evictions are playing a role in the housing that survivors are able to secure.
All the time. We work with survivors who have experienced evictions in the past, and a landlord will see that on their, you know, background check and not want to rent to them. We have worked with survivors who were experiencing evictions now. Pretty much as soon as the eviction moratorium ended in Mass, landlords were lining up to evict their tenants. So we see it all the time. And everything that goes in that background check, like Hima was mentioning, the criminal check, the eviction check, even credit check. Credit scores are a huge barrier for people. Even though they really have no bearing on that person's ability to pay their rent, because people most frequently will pay their rent first before paying off other debts because they need a roof over their head. And it's really just a way to screen out people on that landlord behalf. So I think changing those requirements, or maybe regulating a little bit what landlords can check for, would be helpful, because your criminal history, your credit check, your eviction history, maybe they tell you something about that person who's applying for your apartment, but they really don't say whether or not that person's going to pay your rent.
Yeah, to speak to what Amanda said, we've started working really closely with legal service to see if we could start offering an expungement, like a weekly, where they could just check in. If somebody walked in at Sojourner House, they could check in with somebody from legal services to just see how they might be able to get an eviction expunged, or how they can, appeal this denial, even though, most of the housing advocates know how they can appeal. And we do that with them. But I think that's really important. I think that because of the eviction moratorium, we've started to see more landlords rely heavily on things like credit checks, because they're like, I can't evict you once you get in, so I'm going to screen you out before you ever get in through the door. So we've seen a lot of landlords do things that they didn't do in the past, but now they're putting application fees. That's another thing we're seeing, $40, $50, $60 application fees to apply for an apartment. And, for a lot of our folks, they'll pay the fee, but then they don't even get the unit. So, it's very, it's ways to screen folks out without saying, I'm not going to rent to you, without screening folks out. Do you know what I mean?
Yeah.
So I think all that we've started to see more and more of.
I see some great stuff in the chat as well on the Homes Act. Thank you so much for sharing that, Atel. And Danielle was pointing out that this is sort of a critical, this is even more advocacy towards this building relationships piece with landlords to, help bridge that gap of understanding why are survivors more vulnerable to evictions, and what does that mean that that's on someone's history? Thank you.
Mm-hmm. And Hema, I think the point that you're raising, and Stephanie mentioned this at the beginning, coming together, right? What would it mean to come together to close these gaps? And so the question that I want to pose to the panel is, what kind of collaboration is necessary between housing navigators, shelter providers, we were mentioning here landlords, and DV advocates to prevent and support DV survivors experiencing housing insecurity and homelessness? What would it look like for us to come together?
Well, I think, as some people have already mentioned, that working together is important. The specifics, I think, include a lot of communication, but also in another way, kind of like coalition building. I think that domestic violence advocates and housing advocates together can be a very powerful voice. And I think we could advocate to our, bigger governments about the needs, because there's a lot of creative problem solving we can do. There's a lot of landlord education and relationship building that we can do. But also, I think it doesn't need to be that hard. I think we're put in this position to be creative and be building relationships and work together, which is important, and I want to do that. But I also know that there are 17 million vacant homes in this country and only about 500,000 homeless people. That's like 31 homes per homeless person. So the resources are there. They're not, scant. They're really available. So it does feel very intentional that people are sort of kept down in this level. So I think even though there's a big important piece of working together one-on-one, and that's a direct service capacity, to really collaborate and support people, there's an additional level that we can collaborate together to advocate for big changes that will actually help all of our survivors and the people that we work with in a long-term basis.
I think what you said, Nicole, was really interesting. I've been working with a lot of different groups to talk about intergenerational housing for folks who have experienced trauma. And I can't tell you how many times, not how many times I've had a woman who has experienced trauma for most of her life, maybe in her late 40s, anywhere from late 40s to early 60s, say to me that they want to live in a community where they maybe have their own space with a lock on the door, but they also can share dinners and rely on each other for support, and that they don't get that in a regular subsidized housing, like a housing authority kind of a setting. And so I think that we really need to start to think creatively about how spaces are created. We need to have an active voice in how spaces are created, and we need to be intentional with communities, and we need to always think about folks who have experienced trauma and what it is to be client-centered. More and more we've started to see folks who are on the spectrum, and they really struggle with things like rules and things that maybe our other clients don't struggle with. And more often than not, folks who are on the spectrum will be asked to leave shelter, be asked to leave housing. I think about undocumented folks, and even though they're eligible for our transitional housing programs, a lot of our PSH programs, folks, our permanent supportive housing programs, folks aren't able to access because of their lack of status. I think of our, like I said, our folks with chronic mental health or who are actively using substances. And I just think that we need funds. We need intentional money. We as a community need to get together and talk about all those clients that we think were really hard, but we wish we could have kept helping, and what could have kept them housed. And, so often our clients who have chronic mental health issues are going to community mental health services, which are great. And kudos to the community mental health folks, but a lot of our folks need services, a level of service that maybe the community mental health agency can't even support because they don't have the funds to pay the people to do that. So I think that we really need to sit down and have messy, intentional conversations about who keeps falling through the cracks in our housing, who keeps falling through the cracks in our shelter, and what could we have done differently. We started to look at looking at outcomes of our agency of both shelter and housing, and to think about what could have been different and what services would have kept that person housed. Or kept that person in shelter. And, is there a way that we can try to remake our community and our system to better support these folks? Because the reality is these folks have always been there. We just have never been able to serve them. And so we need to look at ourselves and be like, these folks are all highly vulnerable to violence. What are we going to do to make our services, our housing, our shelters more accessible for these folks? Thanks.
I would just add, in terms of the collaborations piece, I think, we're still in a world that doesn't have kind of universal, or in a state that doesn't have universal education, prevention education around what domestic violence and sexual assault and trafficking look like and are, and responses. And I think that that's critical here, because I think when we're talking about these lack of places where there's a lack of understanding sometimes between, landlords or housing providers and individuals who are attempting to access those as survivors and their advocates, I think a piece of that relationship building is, education around trauma-informed responses to survivors, the realities of sexual and domestic violence. I think that's a missing, sometimes, unfortunately, in our communities, lots of differing understanding of what's actually happening.
Yeah. So thank you all for sharing those perspectives. And I'm wondering if you can provide some concrete examples of how housing advocates can support DV shelters, providers and advocates to navigate the complicated world of housing, this web that we've been talking about of interlocking systems of oppression.
So I think
Sorry, go ahead.
Okay. So I think it's a dual approach. I think that we need to both educate our clients and have time with the clients to have individualized not both individualized and like educational sessions to talk to a person, you know, in private about what kind of barriers they have to their housing and how to actually make a housing like action plan, and be really intentional. And then I think that you also need to do the same, like you're all doing up in Massachusetts and around the country, to really raise the literacy around with advocates around housing, and not just subsidized housing, not just getting on Section 8 waiting lists, but all the community development corporations, all the property management companies that do have low to, you know, low income housing or subsidized housing, to get folks to understand all the different varieties of housing, from 811 to, you know, housing choice vouchers, all the whole mess of it. And then to have someone, and you know, it doesn't have to be everyone, because I do think that everyone should have a knowledge, a base knowledge, but I also think there needs to be like, this is a really good time, again, to repeat what everyone said before, this is a really good time for housing agency or homeless agencies and DV agencies and housing advocates to get together and do collaborative work, right? Because there's always going to be one or two people who are going to be able to do all the networking, know where the new units are, available units. But if they're in contact with other agencies, they can also keep an eye out for them. You know, like we all need to help each other. It takes a village to house, you know, people. And I think that there's a lot of, for many years, I, you know, worked with all the DV agencies, and they'd be like, hey, you know, without telling me confidential information, they'd be like, I've got a family that needs to get out, and this is, you know, they want to be in this city. And then I would call people and see if I could find them a unit, you know, and I think like people would be like, but you didn't get paid to do that. You didn't get this to do that. But the thing is that we're here to help folks. And so, you know, there's other ways. You know, we have to get creative, and we have to look at collaborating in a real way, because in the end of the day, a lot of times DV agencies are very siloed. And I think we need to get out of our, you know, our silos and get to know our neighbors. So thanks.
One example I could point to that we work on in ICAP is we work really closely with the domestic violence specialists at UTA. I want to shout them out. I think there's a few of you on this call. But we've had times where survivors have applied for shelter and gone through DHCD. And DHCD is a system that is incredibly overwhelmed and doesn't necessarily have capacity to give each individual applicant that kind of individualized attention that I think they need. So there have been times where survivors really kind of feel like they've been blown off and they don't know what to do next. And so I've been able to contact DV specialists and ask them, you know, hey, can you put in a good word for us, basically? Can you advocate for us a little bit? Can you find out what's going on? Because we haven't heard from this person in a while. And because UTA and DHCD have such a close working relationship, they have a specific person they can reach out to and say, you know, this person's applying for shelter, they really need it. Can you help us? And that kind of individual advocacy is important right now. I hope that we can get to a point where it's not necessary, because, you know, people have ease of access, and we don't need this individual advocacy just to get one person this help. But I do think those collaborations are there on kind of that individual basis. Like Kelly said, there's always going to be that person who seems to be able to find out where those vacant units are. We call those like the, you know, superstar advocates who just have those connections. But I think we need to kind of standardize that in a way, or make that more accessible to everybody. And so everyone has the person to call. It's not just that one advocate who's been doing this for 10 years and knows everybody. That is available for everyone, so that people can get support no matter which door they're opening to get services.
Well, I just want to thank all of you for coming today and providing your perspectives. And I want to just leave off with one question for the panel. And it's this: if you had all of the resources that we need, if we had all of the resources that we need, what are some policy solutions and changes you'd advocate for?
Happy to kick it off. I so appreciate this conversation because so much of this, these conversations about collaboration and building this village are, very much the hope of the Mass Safe Housing Partnership and, creating that village. So it's not just that individual advocate who has the particular knowledge. I think, with unlimited resources, goodness, I'll keep it a little bit less dreamy and a little bit more in the practical spaces. But I think, that piece about every program having access to housing advocates and navigators and building that kind of internal expertise in sort of multi-generational ways within a program, really building the infrastructure so that this becomes, part of the culture of our advocacy to prioritize and have that kind of housing advocacy built in for the future. I think that's huge. In terms of, I really appreciate the sharing of the Homes Act information as well. And, we're really excited to see that bill and really look at that issue of both whether it's criminal histories or eviction histories that impact survivors from accessing housing. Those are very much on JDI's radar for policy solutions. We would imagine advocating for some percentage of housing units or to be focused, dedicated to survivors. Partly not, I agree very much with everybody who's spoken that, that the vast majority of individuals who are experiencing homelessness are survivors. And there are particular models that I do think that these collaborations that our programs can bring that are really instructive and could be supportive of a range of different kinds of wraparound services that we can offer and those collaborations that we can build. So excited to see that possibility. And some really practical things like improving internet access across this came up in a conversation across the state so that folks can apply. You can't engage with these online systems effectively without stable internet access across the Commonwealth. Better application. These are kind of in the weeds, but have very real impacts on survivors. So just a couple popcorn there.
Thank you, Hema.
So to add to that, I think you can definitely be dreamy, Hema. I think this is a great place to be dreamy. And there's kind of like multiple levels of this because there's those things that we need to do to fix the situation we're in now. We do need to expand voucher access. We do need to increase how much a voucher gets you. I think Etel was putting something in the chat about that, about advocating at the state level for that. We need to kind of reduce these income guidelines that are keeping people from getting help that really do need it. Just because I know I had someone who was denied home base because they were like $5 over income. There's these really restrictive guidelines in place that are really meant to be keeping people from accessing services that they don't need. We have this really big fear that people are going to get something they don't deserve. But unfortunately, that doesn't really prevent fraud. It prevents real people who need help from getting help. So I think changing those requirements is important so that we can improve services we're providing. But in the bigger picture, I also want to think about preventing homelessness from even being a thing. Why do we have 17 million vacant homes and 500,000 homeless people? And there's no reason why people shouldn't have a roof over their head. So unlimited resources and being dreamy, I would advocate for basic universal income, universal healthcare, free childcare, all those things that can help people just be economically stable and healthy and happy. I think people have to make so many choices based on getting their immediate needs met and not what they really want. And if we can provide for people instead of restricting people, we will be in a much better place to prevent homelessness.
Kelly, did you want to close us out here?
Well, after universal income, universal childcare, I don't know where to go with that. I mean that, but I think that I would just, if we had all the money in the world, I think that it would just be nice that every survivor who calls a hotline, who's like, I need to leave tonight, could find a space in a shelter, a DV shelter, where there were where there were advocates who could help them with housing. I have never seen it, and I've been in this work since 1990 something. But people tell me that in the 80s, I don't know if this is true or not, people used to come into shelter and in 3 or 4 weeks they would leave shelter in housing. And that would be great. Wouldn't it be great to keep somebody in a shelter for 3 weeks and then get them into an apartment where they could afford and sustain, and that folks who wanted to find employment could find employment that could keep them and their families safe. I also think, and this is something that I think belongs here, because as I think we need to also start to look at the families that want the abuse to end, but don't want to necessarily leave their abuser. And I think we as DV agencies need to start to think about how are we going to work with these families, and with, maybe without using the criminal justice system, and somehow help that family heal, because I think that is also going to be something that's really important that we're going to see more and more of. Because the expectation shouldn't have to be that families have to separate if they don't want to. So, thanks.
Into increasing discussions about restorative justice, transformative justice, and approaches to domestic violence. So I just want to thank the panel again for providing perspective and context on the intersection between domestic violence, housing insecurity, and homelessness, and also talking about the many pathways into homelessness that survivors face and what we can do moving forward from this context, what we can all do to come together to close the gap. So I want to now shift gears and move into questions from the audience. So we can start that off. If folks have questions for the panel, please don't hesitate to put it into the chat. And we'll start off there. But I do have one question from the audience, and that is about the American Rescue Plan. So one question we have is about the money that's coming in from the American Rescue Plan. How can we coordinate that money to better support domestic violence survivors?
Well, Hema might be able to answer this maybe more in detail, being in the policy world. But what I would love to see with some of this money coming in is helping people possibly buy homes instead of being stuck renting. I think a lot of our efforts in the housing assistance and homelessness world are really about getting people into apartments, getting people leased up. But I would love to see that sort of shifted into possibly home ownership. I don't know how realistic that is at the second, but that's what I want to happen.
Mm-hmm.
I will say, I think there's a lot of levels to this question, and I think it would be great to kind of jointly strategize moving forward about what that could look like. I'll tell you that part of the reason that the Mass Safe Housing Partnership was even able to get off the ground was because of the initial wave of the CARES Act related funding. And that did, bring an influx of resources to be able to kind of coordinate some of the discussions that have clearly been happening with, for a long time across Massachusetts. And, I'm so with you, Amanda, on, if there are opportunities to increase flexible use of funding to really get survivors the resources they need, from, building affordable housing to, other forms of immediate relief. I think that would be huge, but really interested in continuing those dialogues. So please do reach out to us if you have thoughts.
I'm checking in the chat to see if there are more questions, but I'm not seeing any. So again, you can chime in the chat, or you can unmute as well to ask a question. Okay, so Attell wonders if we have data around specific housing models for DV survivors. I see Kelly with the...
I don't really think so. I mean, I don't think there's been enough research around the comparable models of PSH, permanent supportive housing, or rapid rehousing, or transitional housing. I could be wrong, so if I am wrong, somebody please tell me. But I don't think that around DV survivors we've seen any data that evidences that. But
yeah, it really does bring me to this question again about, I've been just thinking historically, there's this interconnected web of all of these systems that need reform, or just how do we think about either moving within these systems or ways to kind of move outside of them? Have folks been having those conversations at all?
well, I'm glad you bring that up. I think that as we do the work, a very smart woman once gave me a sign and it said "fail harder." And the idea, I think a lot of advocates are really afraid to try something or to ask a question and someone say, well, that's not how we do things, or kind of be shot down. And so I think that it's really important that we fail harder, right? Like that we're not afraid to ask some of these tough questions, to keep knocking on the door. Like for example, when we started our rapid rehousing program, one thing that we started to see almost immediately is that large families with one income, right? Like, so you have like maybe a mom or a dad and they have, 4 or more children. A lot of times they're just not going to be successful. They're just not going to be successful. And so, we've already started to talk to the local COC to see, is there a way that we could get those folks a permanent voucher, like a Section 8 voucher, so that they won't have to, fail and be evicted from the rapid rehousing program. So, and the reality is I thought for sure they were going to say, no way, Kelly, no way. But instead what they said to me was, find out how many families you have that have 4 or more kids that aren't doing well in rapid rehousing. We'll see what we can do. And so I think that I want people to hear this. I think sometimes you just have to keep asking the questions to as many people as you can. Keep talking about what you see as an issue, what you see as a problem is, because I think that more often than not, folks are afraid to say anything. They're afraid that they're going to look stupid, or they're going to fail, or whatever. So I really would encourage folks to just keep asking the questions, keep advocating for your clients, and it's okay to fail. That's what makes us reevaluate and do it better the second time,
Thank you for that, Kelly. And when thinking about coming together, one of the things that becomes very important is us sharing resources. So a question that did come into the chat about: are there any resources for undocumented families or families stuck in the immigration system? What resources do you all know about?
I mean, go ahead, Amanda. I saw you on mute. Go for it. I was just going to say, in terms of access to in terms of what resources are available via housing related programming, so the Mass Rental Assistance Voucher Program is accessible to undocumented families, but I don't know if the question was more kind of global in terms of, ongoing support for families who are involved with immigration enforcement related matters. And depending on someone's status over time will qualify you for different types of benefits, and it's an evolving journey for many folks.
So I know, I've been directing a lot of questions to the panelists, but I also want to open it up to Stephanie as well, to see if you want to chime in about any of the things that we've been discussing so far in the Q&A. Go ahead, Stephanie.
I think they're doing a great job. That's what I was gonna say. I wouldn't say anything different than anybody else said, so keep going.
So adding on to here, another thing that we can think about in addition to resources is also awareness around DV. So a question was posed in the chat: how much DV awareness is out there, and specifically thinking about prevention for youth?
I just typed in, I'm happy to say out loud what I typed in, but I think there is so much more room for awareness, right? I mean, we don't, like I said earlier, we don't have comprehensive K through 12 education around prevention education, around what healthy relationships look like, what consent looks like. We don't have that. It's not universal, and it needs to be. The Healthy Relationships Grant Program was an incredible offering, and it was the first prevention specific programming in Massachusetts, which was huge. And it will fund a few pilot programs, right, to be able to do some of that, but it's not enough. And so, JDI is strongly advocating for the Healthy Youth Act to be passed, which again is not even a mandatory type of education or prevention education piece of legislation, but it's a step forward, hopefully. So lots more needed. And I want to uplift, all that aside, I want to uplift the incredible work of programs who are doing fabulous community-based outreach to younger folks across the Commonwealth. It's just needs to be a lot more comprehensive.
So we did spend a lot of time, we talked about emergency housing, long-term housing, and there's a question in the chat about transitional housing. So Jane wants to know, are there any efforts going on to create more transitional housing for DV survivors? Jane says there used to be more programs in MA that she thought was good for some survivors to move into coming out of a DV shelter. So I was wondering if we could take a moment to talk about transitional housing.
I can tackle some of that. I think, Jane, that's a really good point. And you're right, there used to be more programs in Massachusetts. And I think HUD cut funding for transitional housing several years ago, which shut down some programs. And there is, as far as I know, very little federal funding and state funding for transitional housing. But what we've seen is sort of, I think that trying to take what resources we do have and figure out how we can create sort of that transitional model while people are still feeling like they're in permanent housing. I think at Casa Mirna, that's one of the ways that we use the HUD rapid rehousing funding for, because we know it's time limited. Like we're not able to help survivors with their rent long term. It's just a year or maybe 2 years. And so survivors are able to leave shelter or homelessness, move into their own housing, knowing that they've got that rental support at least for a year or 18 months while they're getting support, from us, while at the same time, like, our housing advocates are working to help them find permanent affordable housing that they'll be able to continue afterwards. So I think even what the federal government considers permanent housing resources really are just transitional. And then there's a couple of other models now through the Mass Safe Housing Partnership that we're looking at. So Transition House in Cambridge has a collaboration with Cambridge Housing Authority, where they work with survivors who move into a unit through the Housing Authority, and then after a year, it basically flips into their own unit. And so, like, they show, they can be good tenants and whatever it is they have to show, and then it becomes their unit. And so Transition House sort of supports them while they're there, so that people don't also have to, like, move around. They're not living in a congregate shelter that's considered transitional. And now we're also seeing through the work of Debbie Pilch and the Mass Safe Housing Partnership, trying to do a model like that in Western Mass as well, with Women's Shelter Compañeros, and doing one with Independence House on Cape Cod. So trying to figure out how we can utilize multifamily housing who have subsidized units to get folks in there, at least sort of, transitionally, while they sort of develop a relationship with the landlord, and then that unit turns into their own unit. So I think that's sort of what we're seeing as, like, the new face of transitional housing that's coming.
That is really exciting to hear, Stephanie. I remember when those transitional housing programs got cut. I was working in shelter, and we had a whole long list of all the transitional housing programs. And I remember just calling them, and each one by one, and finding out that they weren't going to be operating anymore. It was heartbreaking. You had to cut our list basically in half. So that is really exciting to hear. And I love the idea of a unit flipping and becoming yours. I would hope to push it even one step further and see if there was anything we could do to create, like, a rent to own kind of program. But do watch out for rent to own programs on Craigslist. Sometimes they are scams. But I think if we could create a real life non-scam rent to own program, that would be exciting as well.
So Amanda, your point is kind of tapping into Danielle's question about further movement in month-to-month units through landowners as a form of transitional housing. She said that some landlords are willing to work with this. So again, kind of thinking through, how do we get to ownership? How do we get to housing stability? As we know, it is at the foundation of all other well-being outcomes. So I was wondering if anyone wants to speak to Danielle's question.
So I'm unfamiliar with Massachusetts, but since it's a federal program, I think many folks who have Section 8 vouchers, they should look into, there is a program through the federal government where folks can put a portion of their rent aside to then acquire houses or homes. So we've had a lot of folks in Rhode Island put a portion of their Section 8 rent aside to home ownership, and then we're able to buy condos, small houses, townhouses, things like that. So I can find out the name of the program. Yep, Itel is putting something in the message right now. The self-sufficiency program, thank you. But yeah, so that is one way that folks who have a Section 8 voucher can move to home ownership. Yep.
All right, well, if there are no more questions in the Q&A, we're gonna end this Q&A session. I just wanna again thank Stephanie and all of the panelists for joining us today. So Kelly, Parlee, who had to leave, Amanda and Hema, thank you so much for offering and providing your expertise on this very critical topic in these times. So with that being said, I wanna turn it back over to Debbie and Itel for some announcements and also for some next steps as we close out this series, this first talk in the series.
Thank you so much, Nicole. That was great. I took copious notes, even though I know there's a recording. It's just a lot of gems here today. Quick introduction. Want to welcome Kiskeya Edison and Sheikh Hasib from the Massachusetts Law Institution Reform to give us a few resources related to COVID-19 and evictions, and then we'll close with just a few steps that we think might be good after this conversation. So Kiskeya and Addison, Kiskeya and Sheikh, the floor is yours.
Thank you so much. I learned so much and I took copious notes as well to take back to our office. My name is Giske Addison and I am with the COVID Eviction Legal Help Project with the legal services component. And what we're doing is working with 6 legal aid programs across the state to deliver legal services to people who are at 200% of the poverty guidelines who are dealing with COVID-related eviction. And the reason why we think now that this is really important to talk about is because there are new resources that are available, including rental assistance, of course, and also just additional eviction prevention assistance earlier in the process than previously had been available due to funding. So I'm going to show a little slideshow and we're going to go through this. And I'm here with my colleague, Sheikh Hasib. Yep, he's waving. Let me share my screen. Oops, hold on one second. There we go. Share. Oops, done. So you should see my screen now. Let me put present mode. So thank you so much for the YWCA and thank you for Deborah Hall for inviting us to speak briefly about the COVID Eviction Legal Help Project. So KELP was formed to expand the capacity of existing civil legal aid programs, as I mentioned, and it's part of a 3-part initiative for the Eviction and Diversion Initiative, which offers rental assistance, legal assistance, and also mediation in some situations. And it's funded through the Department of Housing and Community Development through funding from the governor. So here are the legal aid providers that are providing services. So within your area, I believe it would be community legal aid, but I know this is statewide. So there are services across the state. And so what can KELP offer? KELP can offer referrals, legal information, rental assistance, representation in housing court and district court, and people need to be at 200% of the poverty guidelines. And the eviction must be related to COVID, but there's a very broad definition of related to COVID. And I think you all have mentioned a lot of the different ways that eviction and homelessness can be related to COVID. So I just wanted to show a couple of outcomes because this project was started in October and we were able to bring on attorneys, paralegals, and caseworkers to work on with these different legal aid providers. And that has been an amazing collaboration because it's allowed for attorneys and paralegals to work together to deal with the multi issues that people are facing in a holistic manner. And so these are just some of the case outcomes that we've had since October. And imagine we were bringing on completely new attorneys, completely new paralegals, and they were under the supervision of just really brilliant attorneys and senior paralegals. So what we're going to do now is Sheikh is going to take over and he is going to show the website. So what I can do now is open up the website. And Sheikh, do you want to take over and share your screen, or would you like me to share the screen?
If you don't mind just continuing on, just in case any internet situation comes up on my end. Thank you. So, as Kiskeya mentioned, well, first and foremost, good morning, everyone. Thank you again to the YWCA and Central Massachusetts Housing Alliance for convening this informative and important gathering, and for the panelists who engaged us in this space for a very in-depth conversation. And, as it's been stated, this is the first of many, especially as we continue to uplift survivors and advocate for better policies and programming for access to housing and stability. As Kiskeya mentioned, my name is Sheikh Hasib. I'm the outreach coordinator for the COVID Eviction Legal Help Project at Mass Law Reform Institute. I would like to, Kiskeya and I would like to spend some time this morning guiding us through the KELP website, Eviction Legal Help. And what I will do is, so if you are able to do so as well, I'm going to put the link to the website in the chat. So I welcome all of you to follow along on your browsers. So I would like to start off by acknowledging at the very the top right, as you see, there are 4 languages listed: English, Spanish, Portuguese, Haitian Creole, with a few more other languages underway. And we did this intentionally and purposefully because we do want to be mindful that housing, it's acts like issues that people are facing, especially when it comes to housing. That we want to be mindful of any language barriers and communication barriers that may come up. And also to point out to a couple of other features, the menu under the language listings shows a few different options that I encourage each of you to look through a little more closely at your convenience. But to note, the legal rights and other help pages provide guidance on FAQs on what a person's rights are and what resources are available to anyone facing housing instability. And the What's New page highlights the work that is taking place in the CALP community. As Kiskia referenced a moment ago, we have a great, CALP community with attorneys, paralegals, intake workers who are, engaging with people on a day-to-day basis, doing their best to make sure that, we get the best outcome. And so that being said, what I wanted to focus on today for a moment is how to do a referral. So if let's say someone reaches out to you and your office and is facing housing instability, and they're looking for legal guidance, we want to be mindful that you may not be in a capacity to provide legal advice, but what you can do is obtain their information to provide a referral. So what I'm going to ask, as Kiske already has loaded, the Find Legal Help page is the starting point to do that. When you scroll down, you'll see 3 options. The first option allows tenants to find legal aid organizations serving their area directly based on their zip code. The second option directs owner-occupants of 2 or 3 family homes to contact the Volunteer Lawyers Project. And the third one, this is where you come in, allows advocates to provide referrals. So as mentioned a moment ago, we'll need, a person's zip code because that's the way that a form, as you'll see in a moment, gets directed to one of the legal aid organizations that are part of this CALP effort. And so, as I mentioned, the first step is keeping in mind the applicant's zip code. Once you have that, you can move on to the form by clicking on Use this referral form. And so this is the referral form. And we would like to note that this form is very user-friendly, starting off with asking for your information, so we know where the referral came from. And then we'll get to the bulk of the information, which is the tenant's information. Their address, contact information, any we do want to be mindful of any language and communication barriers. So, if you come across somebody who English may not be their primary primary language, please make note of that. And, if there's a good time for the legal aid organization to be in contact with them. And then it also asks for relevant information on where the tenant situation stands. While optional, it does help. So, please try to get as much information possible. And at the very bottom of the form, you'll see an option that will ask you to select which legal program the form will be directly sent to. This is why we ask for the zip code at the beginning of the process, because then, zip codes are attached to each of these organizations. And then as a final step, we ask that you click on submit and the referral form will be directly sent to the legal service program that was selected. Again, as you can see, this referral form is straightforward and user-friendly. If you do come across any concerns, don't hesitate to reach out to us and we'll put our contact information in the chat. Additionally, in the chat, I will put links to multilingual digital infographics. And so if you and or your office is doing community outreach, whether through email, social media, please do share those infographics. And then additionally, if you're doing on the ground outreach, we're more than happy to send you free multilingual brochures that can be distributed community-wide with the CALP information on it. And so, we will. Sure.
Also here you can see this chart. So if you forgot to put in your zip code, you can click on this chart and it will give you the towns and which legal aid organization they are with.
Yes, thank you. Thank you. That is a very important point to note. And so, yeah, so just to wrap up my thoughts, as we continue to do outreach to communities across Massachusetts, we welcome your perspective and voice in this work. And, we would love to continue to connect with you as this conversation moves forward. Thank you.
Thank you. So if people have any questions, Sheikh, do you want to also put your email into the chat?
Yes, I am typing up my contact information as we speak.
Great, thank you. Thank you so much. We appreciate it.
Thank you, YWCA and Sheikh. And I would love to have some of those brochures as we do some on the ground outreach to families that are facing housing insecurity here in Worcester. So I just want to say thank you to all the panelists, Stephanie, Hema, Kelly, Parley, Amanda, Nicole, our absolutely wonderful, fabulous moderator, and Debbie and your staff for helping create the webinar and for co-organizing and co-planning this with me. I think one of the key takeaways that I have from today is that besides the obvious that the two universes shouldn't be two different universes, there should be just one seamless coordination and talking amongst housing providers and DV world, that we also just need to teach and learn from each other. And I think for Debbie and I and Amanda, as we planning this was one of the key objectives, is to try to figure out where do we start and how do we keep this conversation going. So the general vision is that the next steps, besides sending you the recording of this webinar and the collection of the contact information for our speakers, any resources that were put in the chat, is to convene a series of other conversations and action steps about concrete steps that we can all take, whether that's trainings or more symposiums or increasing our ability to talk to each other. So stay tuned. We will be in touch, and thank you again so much to everybody for coming together. And it was a pleasure having this conversation, and I wish you a peaceful and happy rest of your day. Thanks, everyone.